Hi, my name is Himali Hinkender. Today I am going to discuss about clinical analysis pathways. So, at the end of the lesson, you will be able to understand about clinical pathways and to discuss how clinical pathways are used in patient care plan. Next, to identify the causes for variances and discuss the benefits of the care pathways for the patients and the healthcare workers. So, this clinical pathway, there are many names to identify in different areas. So, clinical pathways also known as care pathways, critical path, and also we called it as care maps. So, when we are going to explain about what is critical pathway, it is a integrate medical treatment protocol, nursing care plans, and the activities of allied health professionals into a single plan which clearly define the expected progress of patient through the hospital system. This was given by the Hinmarsh and Moron in 1994. So, we will further elaborate what is critical pathways. In description, it also called interdisciplinary plan, multidisciplinary plan, collaborative plan, and also critical plan and action plan outlines. So, the crucial assessment and interventions that must be performed by nurses, physicians, and all the other healthcare team members. The daily or even hourly patient outcomes necessary in order to achieve the outcome. It might be discharge goal or the recovery, and it is given the perfectly length of stay. It is already defined how long that patient need to stay to recover. So, critical pathway is a practical tool for specifying, evaluating, and improving the quality of clinical practice. Next, we'll see the component of the critical care pathways. First one is timeline. It is given from admission to discharge. They clearly explain from this end to this end. There are particular dates that the patient need to stay in the hospital or the care institute. And next, the categories of care. It is like activities that need to be performed. Example, intervention that nurse need to be done, and the interventions to be done by the consultants, doctors, other healthcare workers. Might be dietitian, physiotherapist, likewise. It is involving the all multidisciplinary team activities. Third one, it is intermediate and long-term outcome criteria. So, from the admission, they schedule what are the expected outcome, short-term, intermediate term, and the after the recovery. Fourth one, the variance record. Variance is kind of deviation from the expected outcome. What we expect and what is happening. It is a gap. So, we can identify the deviances by looking at the care pathways, and we can document and analyze it. So, I am going to discuss about the objectives of critical pathways. First one, to achieve realistic expected client and family outcome. So, we are going to involve the family members with the patient care. Next one, to promote professional and collaborative practice and care. It involves multidisciplinary team activities in this care plan. Next one, it is to ensure continuity of care. Fourth one, it guarantees appropriate use of resources. By using the critical care pathway, they clearly define which resources to be used at which time. So, we can minimize the wastage of resource using. Next one, to decrease cost and length of stay. It is basically scheduled with the length of stay. So, unnecessary staying in the hospitals will be reduced by applying these critical care pathways. Next, to provide framework for continuous improvement. So we'll see how are these clinical pathways will implement into the hospitals or the care institutes. So we'll see. First, physician's orders for appropriate patient. For each and every disease or the condition or for the patient, it is very difficult to apply the care pathways. But there are certain diseases, certain surgeries, certain patients we can apply this care pathway. It is basically, it should be kind of unique. As example for CABG, like LSES, total knee replacement, influenza, managing dengue. Likewise, there are some examples. So the management is almost similar for each and every patient. It differs from adult to pediatric. So there should be different care pathways. Likewise, so it is appropriate patient we have to select. Next, we have to identify members of the multidisciplinary team to be involved. So there must be many people in the team will be involving. So we have to identify each and every personnel on that, and we have to get the feedback from them, all the care providers, and we have to discuss the existing patient journey and map it out. We have to gather together and we have to discuss about the patient and we have to map it out. It is kind of storyboard. Then regular record to identify effectiveness intervention, including patient's views and feedback. Patient also very important role in this situation. So because of the patient is there, the multidisciplinary team involved on that patient care. So patient also need to know what is happening. So from the beginning, very first day itself, we will be having the discussion with the team members, and we are going to tell to the patients and the family members what we are going to do for the coming few days, and what is the date for the discharge, what is the date for the special procedures, how he can go for this operation. Likewise, so we will schedule and we will give the knowledge for the patients and the family members. Next, we'll see sometimes this care pathway is not running smoothly. Not all the time, but sometimes. So we call it as variance. So variance is, it occurs when an outcome is not met in the specified given time as scheduled in the care pathway. We are not going to achieve those things. So sometimes the intervention is not performed at the specified time. What we planned, we are not able to perform according to the given charts. So it is very simply, variance is the difference between what is expected and what actually happened or occurred to the patients or on the pathway what it happens. So what are the causes for variances? It can be hospital or system causes. Sometimes insufficient equipment or equipment which are there not functioning properly. There might be breakages. Likewise, the hospital or system. Then second one is clinician or caregivers issues. As example, staff did not give proper health education. Very simply, if the patient is admitted for the coronary artery bypass surgery, they need to give the health education on deep breathing exercises pre-operatively. If they have not given that, the good outcome, expected outcome is not able to achieve after the surgery. So that is going to be a negative variances. Then next, patient or family causes also can involve with the variances. Example, patient refused to follow instruction, or patient need to wait somebody to come. So till that time we have to drag the procedure or the surgeries, whatever. So that is also kind of a variance. And next, community services. As example, home care services or follow-up was not done. If they need to come for the suture removal on the particular day, so if they have not done it, that is a variance. So the expected outcome is not going to achieve within the given period. So next we are going to talk about what would you do if you have identified a care variances? We have to do something if we have identified the variances. So, these are the actions to be taken. First, we have to perform an additional assessment to determine the cause for variances, why it has happened. Next, we have to review the clinical pathway, because there are certain steps which we need to achieve during the care pathway while giving care. So, if any area is not achieved, we have to see throughout the care pathway. Then, determine any further actions need to be improve achievement of outcome. So, we have to see at least anything else that we can do to go ahead with same care pathway. So, those things only we have to see if the variances are not achieved. Next, again we have to see what is care variances. While giving care, there can be a deteriorations or not achieving area. So, or kind of unexpected achievement or things can happen. So, we have to see what it is. Example, if the patient having normothermic and suddenly if the fever spikes gone, we have to see it is there in the chart. So, then we have to see how do you detect it. Temperature you can detect by the checking, and what can happen to the patient if anything deviance or variance happen. What are the effects on patient due to these variances, and then we have to see what should we do if it is detected. So, there can be a variances. We have to identify what it is, and we have to see how we detect it, and what can cause to the patient bad outcome or whatever the thing, and we have to see what we can do to the patient if we have detected any variances. So, there are many advantages in this clinical pathway for the healthcare members, patients, and also the family members. So, first one is it provides timeline to achieve specified goals, and we know when to do the procedures, when to do the interventions, when to mobilize the patient, very simply when to mobilize the patient, when to keep the fasting, when to do the surgeries. Likewise, there is a timeline for each and every activities, and there is a good flow on that. So, next, support the introduction of evidence-based practice. To have a care pathway, we have to have a evidence to say kind of this patient can go within this date. So, kind of coronary artery bypass surgery at least 7 to 9 days. That is sufficient. So, evidence is from the previous done records. We have to have a mean value or the mean hospital admitted duration to set these care pathways. Next, support coordination and continuity of care. As I told you, this is a multidisciplinary team involvement. We have to support each other to achieve that given expected outcome. And definitely it ensures the quality of care. The patient will have trust on us, and he will be also focusing this care path, and he know first day what is going to happen and next day what will happen and when is the date for me to go home. Likewise. Then outcome driven, because everybody's aim, it is focusing to discharge this particular patient on the given particular date. Then provide opportunities for healthcare workers to collaborate and establish dynamic plan that considered all of the client's need. So it includes all the needs of the patient, and it is communicated with all the members of the multidisciplinary team, and they work together to support to meet that required needs of the clients. Next, there are many disadvantages also, because this is a kind of, you have to have a good commitment to have this care pathways. example, this may appear to discourage personalized care. Every patient, this should be done. If the patients are coming for the CABG, we need to consider all the patients should go throughout this procedure, and everybody will achieve similar this care. So there might be different illnesses with similar patient comes. So in such situations, we have to see in another way. So we have to go out from these clinical pathways. And risk of increased litigation, because the legal bound is there. Everybody have the responsibility to do this given task on the particular timing. If we are not done or not given, so there might be a legal issues, and the patients and family members knows this time this to be done and this time this to be done. So this is going to be a kind of issue. Then does not respond well to unexpected changes. Since it is scheduled for the particular unique conditions, if any unexpected event comes, what are the things that you need to do is not mentioned in the clinical pathway. But variances happens, we know we need to do something, but it is not clearly mentioned. Then this critical pathway suits standard condition better than unusual. As I said, it is like CABG, like influenza, like dengue, it suits very good manner. But like different types of pneumonia, cirrhosis kind of thing, it is very difficult to have a care pathway like with proper scheduling system. Then, as I told, it requires good commitment from the healthcare workers, and for this there are lack of research evidence, because most of the countries they don't use much it. So, and also we have to tell that there are many benefits for the patients, family members, and the healthcare workers. So we have to see what are the benefits that patient will get. So first, it improved organization and continuity of care. It is well organized plan to give given period. So patient knows what is happening from A to Z. And next one, avoidance of duplication of effort. So everybody knows once they have done, they need to take it. No, then another person will come and they don't need to ask whether this procedure is performed or not. Just it is a kind of guideline they can see. So duplication will not happen. Then involvement of the patient in the planning of care. From the very beginning, during the admission period, we have to have a discussion with the family members, patients, and all the healthcare members. So at that time, we are going to involve the patient in this care plan. Next, use of evidence-based, locally agreed best practice. This care pathway is, we can't say actually, it is institute basis only you have to utilize. So similar care pathway, it is very difficult to apply each and every hospital or care institute. They need to adjust particular care pathway which suit for their institute, their ward, their unit likewise. Then provision of integrated services from more than one organization. It is very simple. It is a integrated services with different people. Sometimes we need to bring the equipment, machineries from other areas. So patient knows what is happening. Next, provision of a manager. It is a kind of patient see this care pathway. It's a kind of given document, and it is a manager. It is a kind of manager. So we do everything according to the given guideline. Next, receipts of the printed or electronic copy of own care pathway. Patient can get a copy of care pathway, even sometimes hard copies, or even it is uploaded into the system. Patient can view, family members can view, and they can see what is the progress of the care pathway. Next, the benefits to the clinicians and the practitioners. Here, first one is availability of patient records online for viewing. So each and every time they need to come to the hospital or place where the patient is there, they need not to read the kind of patient's details or master charts or whatever. they can view wherever they go via these systems. Then capture of clinical terminology and codes to improve quality and aid subsequent analysis. It is like we can use different terminology for the healthcare workers which they can understand, and we can minimize the word count which we are using in the care pathway by using the codes for sometimes for the diseases or short terms likewise. Then availability of the most up-to-date guideline and best practices. Every time we need to update for the given time period, we need to update. We can gather the evidence from the usage of these clinical pathways and how it was successful. Is there any changes that we need to do according to the hospital policies? Likewise, we have to update it. Then ability to feed into the development process to provide continual improvement. During the care goes on, sometimes you can identify this is not going properly. So then and there, they can give the kind of their opinions, and even if they are not there, they can enter, they can provide their opinions or suggestions to go ahead with that. Next one, ability to monitor progress along a care pathway. So by looking at the care pathway itself, you can see what are things that they have done and what are the outcomes that they have achieved up to now. Sometimes you don't need to wait till the last date comes. Every day, every hour, it is updating. Next, ability to measure deviances from a care pathway with reasons for that deviance. So we know if we are not able to achieve anything, there is a deviation. For deviation, there is a place to identify deviation and go ahead with the deviation. So it is kind of go ahead with deviation. We have to recognize whether it is negative or positive, and if it is negative variances, we have to do according to the variances occurs. Next, ability to integrate local and national standard. When we are creating the pathway itself, we have to see which are the areas we are going to tally with our requirement, our standards and the universal requirement. Last, ability to document by exception. Unnecessary things you don't need to write. There are particular areas given in a sentences wise, so you can minimize the writing. There are another benefit that the healthcare managers will achieve by using this critical care pathway. One is improved ability to plan and measure the use of personnel and resources. Healthcare managers are the people who manage the care resources. So even the infrastructure, healthcare members and the resources, it is a very limited. So you have to use this in an effective manner to achieve good outcome. Next one is ability to measure the difference between planned and actual care. So example, middle on the pathways, we can see whether we have done the things properly or is there any deviances, or there are areas that where we don't need to do. Likewise, we have to see actual and planned care. Then delivery of more standardized care linked to the protocols and treatment plan. So when the care pathway is there, everybody will follow that. So individual preferences and the individual different attempts, there is no place for that. So everybody who comes even from the outside or the different other healthcare institutes, they need to adjust to the care pathway where they are in, and they need to follow that. They need to adhere on it. Likewise. Next, redesign of healthcare delivery mode made possible. It is a kind of thereby avoiding safety and quality risk. By using these clinical care pathways, we can improve the quality, we can improve the patient safety, and we can minimize the risk that going to happen to the patient. Next, it is ability to continually improve care pathways. As I told you, we have to update and we have to go ahead with the new standards and new achievement. Next, last one, ability to document by exception. As I told you, it is given clearly, concise document should be there, and it is kind of saving the healthcare workers' time. This actually I have discussed about the critical care pathway. What is critical care pathway and why it is important, how we can have a critical care pathway in our institute, and what are the benefits for the different workers and family members which they are going to get, and advantages and disadvantages. So thank you.